A lot of people have carpal tunnel style symptoms or repetitive stress injuries, and it's no surprise when we think about the tools of the modern day. A lot of us have one of these devices and we hold it like this for many hours or minutes per day. A lot of us have a computer, so we're either grabbing a mouse like this and we're holding our hand in this position, or maybe if that doesn't feel good after a little while, we'll dose in an easier mouse, and we'll have a mouse like this that really allows us just to use the fingers, and we don't have to ask for much wrist and thumb movement at all. But a lot of these issues that people feel in the thumb with their grip or in the wrist as part of this carpal tunnel repetitive stress injuries can be reflected in what's actually happening with the way we grip and how our wrist works. Now, there can certainly be some issues at the elbow, at the shoulder, and even at the neck. But I found a couple things really stand out when people have discomfort in this part of the wrist or going up into the forearm as well. So the first thing that I like to assess for something like this is what the thumb can do. And I'll ask somebody to perform a thumb car, which is effectively trying to move your thumb around and nothing else in a nice smooth circle and see what that looks like. The most common thing that I see is that as somebody is making this motion like this, when they actually move their thumb down this direction, they'll bend this middle part of the thumb here. You can see the thumb is made up of this joint here out by the tip, this middle joint here, and then there's a bigger joint here that actually joins in closer to the wrist. And you can see that there's a big difference between my thumb traversing a circle, primarily moving at this joint, versus if my thumb traverses that circle and this joint bends to move this joint over like this in a gripping motion. Now, why is that important? It's because most musculoskeletal symptoms and problems are because some joint achieves a position that it can't achieve itself. So in this case, this joint is moving towards the other side of the palm, but this joint is actually the one that's making the action to do it. And for somebody with discomfort in the thumb and with their grip, you'll often see that it's really challenging to move this over and not have this joint here, this smaller joint, move this big joint over. So during their thumb car, you won't see a nice sort of straight thumb like this, but every time it moves towards the pinky finger, it will bend, and then it will straighten out, and then it will bend to move back in this direction. So the way we want to start to program that to be a little differently is to start with the thumb straight out in one long line and start with tiny little circles, and notice, when does my thumb want to bend? And we try to make a car's motion in a smaller range of motion that doesn't force that to bend. Over time, we can start to expand that range of motion and always trying to be as conscious as we can about not having that thumb bend when we're trying to target movement at this joint instead. Secondarily, and related to this position, we can see that we want to have this motion come together as part of our gripping motion, especially for a mouse, and we can check the passive range of our palm flexion here, sort of the butt of the palm. So we can relax our hand, squeeze our palm together like this, and then try to hold this position while I let go. So I'm using active effort to hold this part of my palm together. Now, if my thumb has to bend here to do it, that's kind of a cheat. We don't really want to see that. So we can relax the hand, pull the butt of the palm together, and then try to hold that position without actually bending the tip of that joint. What we'll typically see if somebody has this compensation in their thumb or not a lot of strength in this part of their wrist and palm, as we pull this together, we'll see a range of motion here. And then as we start to let go, we'll actually see the palm open back up. Now, it may not go back open all the way flat, but what we'd like to see is that however far we can hold this, I'd like to be able to make active effort and have almost all of that range of motion held there actively, and not have that, after we squeeze it, not have that open back up and sort of become more of this open state. That's going to be an active-passive gap. So we have a range of motion that we actually can't put and hold ourselves in, but meanwhile, when we're trying to grab a mouse or our phone, we are actually going into that range of motion that we don't own. And anytime we go into a range of motion for repeated durations, repeated frequency, or under load, it's going to cause us discomfort.